Hello, my name is Yarix Ortiz. Advanced Mycosis Fungoides. Definition. Mycosis fungoides is the most common expression of cutaneous T-cell lymphoma and occurs as a skin condition in which outbreaks of flagellation appear in the form of thin plaques or small tumors.
The title of my study is Second Malignancies in Mycosis Fungoides. In this study, we used two methods. First, we looked at a cohort of patients at the University of Minnesota, 172 patients with Mycosis fungoides seen between 2005 and 2017. And second, we looked at a cohort of patients in the population-based SEER database from the NCI, where we had 6,742 patients. We found of the patients at the University of Minnesota cohort, of the 172 patients, 24 developed a second malignancy. This was compared to a control population of patients with seborrheic dermatitis, 3 of whom developed a second malignancy. We found that patients with tumor stage disease and with advanced stage disease, meaning stages 2B or higher, were at increased risk of developing a second malignancy. In the SEER cohort, we were able to more accurately calculate risks of individual malignancies. We found that patients were overall 10 times more likely to develop a second hematologic or solid malignancy overall. In terms of risk of solid malignancies, patients were 7 times more likely, and for hematologic malignancies, they were 47 times more likely. We found that patients have an increased risk of developing a second malignancy during the first 6 months after diagnosis and between years 12 and 15 after diagnosis, although there is a statistically significant increase along the entire time period. And we found that patients aged 30 to 50 are at dramatically increased risk of developing a second malignancy, although patients across the age spectrum were at increased risk. The most common second malignancies that we saw were lung and bronchus, non-Hodgkin's lymphoma, nodal and extranodal, melanoma, colon and rectal cancer, female breast, and prostate cancer. And the reason we think patients are experiencing increased risk of cancers is we believe that this may be due to immune suppression secondary to the Mycosis fungoides, although further studies need to be performed to really determine if that's accurate.
Nursing application. Various treatment options are used through a local treatment with cream and ointment, low-acid drug injection, application of ultraviolet or radioactive, radiation or chemotherapy for the treatment of the disease. They are not curative, although they do treat elective symptoms, such as itching or burning, patient or plaques.
Mycosis fungoides, the range that could be cancer, and the lymphoma that is first diagnosed, not by an internist, but by a dermatologist. This is Mycosis perfectionalis, and let's get started. If you have watched my previous video, and of course you should, on adult T-cell leukemia or lymphoma, we have learned that T-cell malignancies will have skin infiltration or a rash. Just a quick reminder, if you can help me reach 25,000 subscribers on YouTube, I'll start a new series on one of these systems, and we will vote on it. I'll let you choose, and you can choose more than one, and we can do them together. Thank you so much in advance. Please consider sharing these videos if you like them. Now, Mycosis fungoides is a wrong name. Why? Because it means fungus, and this is cancer. This is not fungus, although I wish it were, because it would have been easier to cure and treat. Mycosis fungoides is by far the most common cutaneous T-cell lymphoma. Neoplastic proliferation of the CD4 helper T cells. Again, when there is a T cell malignancy, there will be skin invasion. first they come in patches, then plaques, then generalized erythroderma. Sometimes they form Potrier microabscess. Lately, lymphoma will go to the lymph node and to the visceral organs, plus you'll find some circulating tumor cells in the blood, and now we call this Sézary syndrome, the guy.
Pros and cons. Pros. Stage 4 disease. Age over 16 years. Transformation to large cells. Cons. In contrast, more than 16 of patients with stage 4 disease die from mycosis. Fungoides median survival is about 5 years. Problem applied and the Ecuador. It has been a great task in order to improve the reality of fungal disease. The country needs to work on surveillance and diagnostic of prognostic and investigate endemic infection. You should also consider a mandatory national register to know the border on fungal infection. It has also subjected in education the population and health professionals of this subject, improving mycology programs and university medical technology school and health care laboratories.
Soy Diana Bolaños y les voy a hablar de Mycosis fungoides. Por su nombre todos pensaríamos que es una enfermedad de hongos, pero no es así. Esto se refiere más a la apariencia, ya que en 1803 un dermatólogo francés describió una lesión en un paciente, la cual se parecía mucho a las lesiones de hongos, pero posteriormente iban a haber tumores como las setas de los mismos. Este va a tener tres etapas, una de máculas, una de placas y una de tumores. Su etiología es desconocida, pero se puede atribuir al virus linfotrópico humano y su diagnóstico netamente es una biopsia cutánea. Además, hay un síndrome asociado a este, que es la leucemización del mismo, es decir, que va a haber también células anómalas en sangre y además hay linfodenopatía.
Conclusion. Mycosis fungoides is the most common type of cutaneous disease lymphoma. Due to its indolent and sometimes not very itchy characteristics, the patient does not cause until late stage on the disease. Likewise, its